Hello and welcome to another YouTube channel by Doctor with PD. My name is Andrew Dean and I am a consultant geriatrician and I've had Parkinson's disease for a year and a half. Today I want to speak about speech problems with Parkinson's disease, and I hope this is helpful for people with young onset Parkinson's disease, people with speech problems and people who are caring for people with Parkinson's disease. Speech problems are not often spoken about but are very helpful to be aware of because it can have a lot of impact on people with Parkinson's disease. There's been a recent campaign by Parkinson's UK where one of the stigma associated symptoms that people get is because of the speech problems they sound drunk because of slurred words. I personally haven't had that problem so much, but I do have a problem with my speech. This time last year I was assessed by speech therapy, who measured my decibels and my clarity of my speech, and what they recorded was the decibels of speech that I have recorded. So the normal speech is between 60 and 75 decibels, and when I was assessed last year my speech was between 55 and 63 decibels. So I could still be heard, but I was just quiet. How did that affect me? Well, I was less confident. I would speak less. I would have to wait for other people to speak before I could speak, which is often not a problem, I suppose. But when you're trying to get across your point to a large group, that can be problematic. So I suspect people might struggle socially with this because their speech is not good enough. They may just not speak at all. For me, it affected my work, and I'm sure a lot of people with young onset Parkinson's disease struggle with their work because of their speech, particularly if you're having to communicate over the phone, where you want to sound assertive. You may end up having to you may not be able to speak for as long as you would like. So speech can be improved, and this is what I want to focus on. So speech therapy involves two main aspects. One is the medications, because the dopamine in the brain being low does cause speech problems, because speech is produced by the muscles of the vocal cords, the tongue, the lips, the mouth, and therefore coordination of the muscles is required to speak clearly. So if your dopamine levels are low, for example people with Parkinson's disease, then you're going to struggle with that. And so therefore dopamine medications like L-Dopa are helpful. The other aspect is speech therapy with the speech and language therapy team, otherwise known as a SALT team. They are really helpful for helping with communication. What they did was they measured my decibels and they referred me on for the Silverman Speech Therapy course. And I would highly recommend anybody with young onset Parkinson's disease or people with speech problems and Parkinson's to be referred for speech therapy assessment. The Silverman therapy does work, and it focuses on making people louder. It is an exercise regime, and people often don't realise quite how important the exercises are. So you'd be given exercises twice a day for 4 weeks, and you'd have 3 one-hour sessions per week, and that can be quite a big commitment. But if you do commit to it, it does pay off. What you put into it does come back to you with dividends. So I did that, and my speech is now 100% in the normal range rather than 30%. So my voice is now pretty much back to how it was before Parkinson's disease, and certainly my confidence levels with my speech has improved. The exercises, just so you have an idea of what you're going to be doing, focuses on having an improved volume and quality of the speech. What they say is don't shout, but to try and speak loudly. So think loud and speak loud is very much emphasised. They often will focus on the change of the tone, go from a low to a high, ah, and go from a high to a low, ah, as well as trying to maintain a loud ah, which you'll be getting used to doing. It sounds a bit funny, so you may prefer to do it when in privacy. So I did it when I was in my car on the way to work. On the way back from work, I'd do my loud R exercises. And then, of course, you do different exercises whilst you're at the lessons. It works, so please be referred early. So people with young onset Parkinson's disease, I highly recommend it. Of course, there are other aspects regarding communication, so facial expression can be affected, as well as the understanding of the cognition aspect, so you can get word finding difficulties later on with Parkinson's disease. But today I wanted to really focus on the young onset Parkinson's disease patients, because I think if you're aware of your speech problem but you're not sure what to do, seek referral to the speech therapy team. They will help you. So it works, get referred early. So that's a bit on speech. Clearly, if there's anything that I've not covered, please comment below with questions. Please like and subscribe. Please share this video with other people you think would be helpful. And please spread the word that Doctor with PD is producing videos, and I will respond to questions for future videos. My aim is to get a series of videos on a lot of topics that are not necessarily always covered in other YouTube videos from the perspective as a doctor and as a patient. So I hope you find this helpful, and I hope to hear from you soon. Bye for now.